Hey, thank you very much, Tyzo. Well, every Monday we get a chance to ask a specialist. Don't know if you checked your calendar, but 6 days from now we celebrate Father's Day. Right now we want to welcome in Dr. Stuart Tsuji. He is the staff radiation oncologist at the Queens Medical Center. This morning we're talking a little bit about, and it's very timely. This is National Men's Health Week, and we're talking this morning about prostate cancer. Good morning to you, Doctor.
Good morning. Thanks for having me on there.
First off, tell me, how would someone know if you have prostate cancer? Is there one thing, or is it a combination of things?
Well, unfortunately, really the only way to know for sure is to have a biopsy, because I'm not sure if you have a picture, but prostate cancer basically could arise in a normal-sized gland, like on the left. So in that situation, the patient would not have any symptoms at all. So there's no way we'd be suspicious that there's a cancer there.
Okay.
On the other hand, it could also present in someone who has an enlarged prostate, like the picture on the right. So that patient probably would have some difficulties with urination. But just the fact that the prostate gland is enlarged doesn't necessarily mean that there's cancer, because a lot of times actually it's just going to be benign overgrowth. So in that situation also we would need a biopsy. So that may lead somebody to believe, well, does that mean that every guy should just get biopsied for prostate cancer? And no, the answer is, that'd be excessive and sadistic. So there needs to be better ways for us to determine who needs a prostate cancer biopsy.
Let me be real honest with you. Okay, so if a guy is having a hard time with urination, should he, and may have an enlarged prostate, should he be concerned and maybe hesitant to go in thinking that it's enlarged, it's going to be really something real serious?
No, because like I was saying, most of the time when guys have problems urinating, it'll be from a benign disease. And so it would be important to go see a urologist, and the urologist can do further workup to decide whether or not they need to have a biopsy done.
Okay, I think we have another image as well. I want you to tell me exactly, should I be checking my PSA? What exactly is a PSA?
Oh, so like I was saying, since there are no symptoms that directly they're necessarily suspicious for prostate cancer.
Okay.
A lot of men are asymptomatic, so basically we need another way to determine who needs a biopsy, because we can't biopsy everybody.
Okay.
So the PSA test is just a blood test that we use to indicate whether somebody needs to have a biopsy or not. And when it's elevated, then that's when somebody would go in to see the doctor and have the test done by the urologist. And usually the guideline is that patients who are over 50 and otherwise good health start with PSA screening. Also, if you have family history, like if your father or brother had prostate cancer, then you might want to start a little bit earlier. Or if you're African American, because your risks are a little bit higher in those groups.
So it's like a lot of cancers. That family medical history has a great deal in charting exactly when you might need testing and that sort of thing as well, right?
It does have some role. For prostate cancer, family history is not as important as some others, but definitely it does influence when we start PSA screening.
Okay, if you don't mind, doctor, stick around. We've got a few more questions. We're talking about prostate cancer on this Monday morning. As we said, 6 days away from Father's Day, so we want to make sure all our fathers out there are nice and healthy and live nice, long, productive lives.
Right, sure.
Okay,
I'll stick around.
Thank you, doctor. We appreciate that. All right, he is named Ippy. You're going to want to find out more about Ippy, because when he is cooking...